Nigeria has invested considerably in reproductive health, over 15 million US dollars in the past 10 years or so, and reaped the full benefits that come out of it in child spacing and better nutrition and ease for the families to go to cater to the children they have.
Family planning alone can reduce maternal mortality if we have universal access to up to 25%. That is many lives saved.
Family planning or child spacing is not about stopping families, it's actually about getting better families.
Social mobilizers met Lami Danladi, a mother of 17 children who had never heard of family planning.
By the time I gave birth to my 17th child, I was totally fed up with childbirth. We hardly have food to eat. We don't even have beds to sleep on, nor good clothes to put on. I'm constantly suffering, but I did not know what to do to stop it. Then, by God's intervention, I met Jamila, a social mobilizer. She took me to the health facility where I received family planning services. From that day on, my life has been getting better.
This meeting is a great idea, and I believe there's no any other important meeting as this, bringing people to come together and deliberate, discuss issues around factors that hindered effort toward achieving goals of child spacing commodity in this country. We need to continue intensifying effort, changing community perceptions, improving awareness, creating a lot of evident ways to enable discussions at the community, at the state, at national level, to ensure that people understand the value and the value for life, value for health of the mother and the family through using modern family planning commodities to save life of the mothers and life of the child as well.
The FP 2020 was a global partnership with the aim of improving the investment for women and girls to access right-based family planning, essentially to reduce appalling global maternal mortality ratio, especially among the developing countries like Nigeria, for example.
For maternal health, you know that maternal mortality is still in the region of 515 or so per 100,000 live births, which is quite high. And then recently, our under 5 deaths is about one of the highest in the world as we speak.
If you look at contraceptive prevalence rate, you will see that for the first 2-3 decades, it hasn't changed significantly for more than 2 percentage points. 12% of women are using modern contraceptives. And if you compare it to many countries in the world, even those that are really below us in terms of the economic classification, we're really doing very bad.
The population is growing at about 3% roughly. That is, in the next quarter of a century, we could double. And by 2050, we are estimated to be the 3rd largest country in the world.
The status of the family planning landscape in Nigeria, there's been slow progress over the past few years, but it's heartwarming to note that we are not stagnant. However, despite this progress, there are a lot of disparities from all the zones. For example, the southern zone is moving much faster than the northern zone. However, even within each of the zone, there are some remarkable progress. For example, some states in the northwest of Nigeria are really progressing quite in an encouraging manner.
A woman, let's say from Yobe State, is likely to give birth to 7.8 children in her lifetime. Whereas a woman, let's say from Enugu, she may be able to give birth to like 4.2 children in her lifetime. And therefore, I think that part of the approach that we need to do as a country is also try to Yes, it's good to look at the national figure, but look at also the geographical differences, and then try to map out, what kind of solutions do you want to bring about that respond to those specific situations. So you don't have a national solution to a problem which also has some regional differences.
Nigeria has made a lot of progress. If we look back from the first family planning commitment that was widely communicated back in 2012, if we look, for example, key commitment that include making sure that family planning is fully included within the basic primary health care provision fund, that has been achieved. On the other hand, even though progress have been made, we still have a long way to go.
The challenges that are impeding family planning in Nigeria are many. I hate to start with funding, but it is fundamental. Funding level is low. We can talk about what the federal government is putting into the Federal Ministry of Health, but at the state level, in terms of ownership, in terms of sustainability and buy-in, it is very, very poor. If states can allocate funds, even if it is 10% of their annual budget for FP, we will not be in the situation that we are now. We've come to a stage in which Nigeria should put its money where its mouth is, or vice versa. Increase the funding so that if tomorrow the donors pull out, we will not find ourselves in a fix.
Cast your mind back from the FP 2020 commitments. Since it started in 2011, the commitment has been going on, though we are not meeting it. It was renewed. So you look at 2017-2018 commitments, were 100% paid. Counterpart funding were paid by the federal government. We had challenges in 2019 where about almost, I would say 30% of the commitments were made. But also there has been intensive advocacy, to the government of Nigeria through support of our civil society organization. And the government has truly demonstrated a lot of commitment in the last few years. Even despite COVID, this 2020, the family planning is still within the budget, and currently it is being released. And we are very optimistic that government is going to realize the 100% commitment of this year.
One of the challenges we have is that we do not have enough funding. And we come back to the commodity challenge. So this year alone, we have a funding gap for commodities of $5.3 million. And for me, the challenge in that is, and also the tragedy, is that yet again, it's going to be women paying the price. Because when women cannot access family planning, it is the mother that dies, it's the woman who dies. And I think that is a tragedy also for a country, because all that potential will be lost.
To improve services in the country, number one, we must make sure we provide adequate resources, money for buying the commodities. The second one is we must improve our logistics system.
Commodities may be procured, but getting them from the place of where they are stored to the last mile, to the person that needs them, the woman or the family that needs those commodities is a big challenge, because the Nigeria's health commodity supply chain system is quite weak.
I think the effort thus far is also looking for innovative ways, maybe by partnering with private corporations who are leaders in logistics management. They also look at integrating all commodities. I think the government of Nigeria had started that global chain for integrating essential commodities, which family planning is one of them. over the past few years, they've started efforts in doing that, running it and testing it out in some states to learn lessons, and finally scaling it up right now. When that is fully fledged, then we will be able to address the issue of stock out at the last mile.
It's time we privatize the logistics system. That's what some countries outside Nigeria have done. Kenya has done it. Rwanda has done it. They have seamless delivery of commodities across their country.
So I told my husband that I was going to adopt a family planning method, but he refused. I started using implant, but my husband found out and sent me packing. He said he does not want to live with a barren woman.
I think we still have a major barrier, which is the sociocultural belief in family planning. We've made some progress, but we are still far away from it. People still do not see family planning as a major critical intervention for life saving, especially the lives of women and children. And people look at it more as a population control, which it has transformed now to a population management issue. Most women, especially in certain parts of the country, they are not empowered to make the decision, even when it comes to issues that affect their lives, especially issues of spacing and then the number of children that they want to have. So just critical decision making are not only left to the woman alone. So this also creates a barrier in terms of how does she have access to family planning? How does she decide the number of children? So what we have tried to do is to ensure we have greater involvement of male in the family planning space. And then the more you educate them, the more you create a lot of awareness, you begin to see the impact. And I'm happy to mention we are beginning to see the impact. I mentioned in some of the states where they have a statistics of less than 0.1%, 0.5%, they went to 3% within a short period of time, and then to 5%.
Since when she took up this method of family planning, we are really enjoying ourselves. We are really enjoying our marriage. So there's nothing like we are thinking of unwanted pregnancy, all sorts of things. So we are free our mind, and me and my wife can be able to enjoy ourselves as a husband and my wife.
Let's de-emphasize reduction in the number of people in terms of population. Let's emphasize the most important benefit of family planning as a reduction in the death of our women at birth. If we move that emphasis, I can tell you one thing will happen. I know that a lot more traditional rulers will be willing to speak. I know that a lot more religious leaders will be willing to speak about family planning.
Why would you intentionally put yourself through so much problems that you could prevent? The new National Family Planning logo is a quick reminder to everyone about places where safe and trusted modern family planning methods are provided. I support the Green Dot logo family planning campaign. Please go for it.
The political leadership in the country really needs to understand the consequences of lack of the work around family planning. It has to show the political commitment, and political commitment has to show demonstrated by, at the highest level, at the level of the president himself, to come out and talk about what does that mean for a country like Nigeria to be the second or the third largest population in the next generation. If you say you have 10 million children who are out of school, you can just imagine what will happen to us in the next generation of other things. If now we don't have even water to drink and other things, just imagine what will happen to us in the next generation of other things.
We have left it all to partners. That's where we are, where advocacy is done by partners, where resource mobilization is done by partners. We currently receive contraceptive products from partners from outside. I don't see how long we can continue this way.
The government needs to understand that their role is overall. They need to take over. I think the government needs to say that, look, this is my overall plan, and this is where I think partners should support us. This is where I think partners, we need support from partners, rather than just being there and being a passive recipient of partners' plans.
We all know that for a proper family planning program to be implemented in the country, it starts from the policy. And I would at this point applaud the efforts of the Federal Ministry of Health, who have championed several policies. However, implementation has been poor. One very quick example is young people are still unable to freely, without bias, without judgment, access family planning services. And that's because, the structural, the social-cultural issue or providers' bias. They feel, you're too young, what do you need family planning services for, and all of that.
I think the development of youth-friendly centers will certainly promote utilization by these young ones, because often they do not like to go to adult-based facilities in case their parents, friends or colleagues see them there. So we need to design a youth-friendly center, probably even manned by youths themselves. I think one of the innovations introduced, especially with the injectable, is to promote self-injection. Self-care is the new buzz language, and the injectables have been spearheaded, to improve access to these commodities. And over the COVID period, we've seen that promoting self-injection has been acceptable to more clients.
I think we've got to bring some creativity in terms of the way we do business. COVID-19 has taught everyone a lesson, especially for those of us who are working in the field of family planning. Suddenly we've seen a gold mine in terms of how we can use the social media to promote family planning. If there are some organizations that have free toll lines that people can call to get services, so be it. People buy things online. We look forward to a situation where people will begin to buy family planning products online.
So our vision for reproductive health and family planning in Nigeria is a Nigeria where every woman, every child is able to access the reproductive health services that they need with the minimum barriers to their access.
Well, I would like to see a nation where family planning becomes a household name and phenomenon. I'd like to see in Nigeria a situation where our service will be second to none in the world. People can come and they say, okay, we are getting as good a service for family planning service here as we can get anywhere in the world.
Integrating family planning in the newly launched RAMCA plus nutrition is also an area where we can use the platform to improve the family planning space in the country. Another important point again is quality data. We need quality data from evidence-based research to inform good policy in family planning space in the country.
We'd like to see a time where governments can actually decide on what its minimum package of services, whether for FP or other related RMNC services are, and have the funding, whether it is locally generated funding or funding that is coming from other sources.
My dream actually is to see National Health Insurance Scheme take the full hog of service provision available so that even those who are locked on, whether at the poorest of the poorest community, making sure that the maternal newborn child health and even the health of the elderly is well covered.
I would like to see a Nigeria where there is an improvement in health-seeking behavior, where women are able to look after themselves, to have their routine examinations, to be able to benefit from all the measures that the health system is providing, especially with the introduction of the basic health care fund and universal health coverage.
I really want to appreciate tremendously the family planning stakeholders, the civil society organizations. Their voices, their strong voices have made a big difference. So I want them not to relent. They should continue to add their strong voices. They should continue to be critical where we are doing wrong, constructive criticism. I think that was what helped us to be where we are today. And I want to appreciate all our development partners for all the support they have done, in Nigeria, right from the beginning, trying to work against the cultural norms that exist, and then the weak services, strengthening the weak services. And today we have a lot of communities benefiting from family planning commodities.